older patients may be dealing with a variety of life circumstances that impact their health. As their healthcare provider, you may become aware of some of these circumstances, such as a fall that resulted in a visit to the ER or the death of a patient's spouse. But other things may not be so obvious, nor will the patient even think to tell you about them. Why? Well, they may be embarrassed, they may not remember, or perhaps they just don't realize the connection between these incidents or circumstances and their overall health. Dr. Asa Oxner tells us why it's important to talk to your older patients about changes in their lives and why you should connect them with community resources that address their issues in order to help them get healthy and stay healthy.
Some of the most important lifestyle factors that impact an elderly person's health are things that are around their home that they either don't have access to or that they have to live with and deal with. So for example, if they have transportation problems where they're in a wheelchair or they need to use a walker all the time while they're at home, that impacts maybe which rooms of their house they're able to go to. They might not be able to go upstairs to their original bedroom, and now they're sleeping in a recliner chair. So they have constant swelling in their legs because they're always sleeping in a recliner chair now. Or if they can't get out of their house because they need that wheelchair or that walker, but they're on a stoop and they can't get down the stairs, then they no longer have access to do their own grocery shopping. And so that impacts all of their health, their nutrition. Maybe they're on a low-salt diet, but they can't shop for themselves, so their son brings them a jar of pickles, and that's what they eat. I've had patients like that. So those things really impact their health a lot, because if you don't have good nutrition and if you can't get out of your house, then you're very socially isolated and you're dependent on others for your health and your nutrition, and it's very impactful.
Here's an example of how a patient's loss of a spouse, for instance, can impact various areas of their health.
I've been a diabetic for several years, so I know how important it is to take my meds, watch my diet, and exercise. And I was doing okay. But after my wife passed away, I started feeling pretty down, and I stopped paying attention to my health. Brenda and I would walk every night after dinner, but I just didn't enjoy walking alone. And she was such a good cook, I never had any reason to learn. One morning, I started making breakfast. Can you believe I set off the smoke detector making a piece of toast? But at least I was taking my meds every day, and that is, until I got the flu. The flu hit me like a ton of bricks. I wasn't eating and drinking, and I got really weak. To make things worse, I didn't pick up my diabetes medications. I had no idea how quickly my health could slip away.
The death of Jim's wife led to his poor eating habits, which impacted his diabetes and overall health. But good nutrition is critical to any elderly patient's health, even those who do not have an existing chronic condition.
It's sometimes hard to find out if a patient has true nutritional issues. And for the most part, we rely on asking patients questions about certain disease states. So for example, if they have diabetes, it tends to come up in the conversation that you would ask them, do you eat a lot of carbs? Do you eat a lot of sweets? Do you count your sugars? If somebody has heart failure, it would come up that you talk about salt with them. But outside of those disease states, physicians aren't really triggered to talk about nutrition as just a general conversation with all patients. But I would argue that for elderly patients, we really should be talking about it at least a little bit. So you can ask just a simple question in your social history, do you cook for yourself? That could be that can just be the question that you ask, because that will get to, if they say, yes, I cook for myself, I don't have any problems, then okay, great. But if they say they don't cook for themselves, then that helps you get to the other questions. Is that because you can't shop for yourself? Because you can't get out of the house? Is it because you can't afford to cook and you just have to eat canned food every day because you're on a fixed Social Security income and you don't have anything else? Or is that because you have dementia and you started leaving the stove on, so your family disconnected it and you can't cook anything, or really what is underlying this issue of not being able to cook for yourself. So if you add that one question to your social history, you can add it for all patients, but especially for geriatric patients, it opens the door to find out a lot more about what they're really doing at home.
Another important factor to consider in older patients is the impact of social isolation and loneliness.
One of the things that's the most impactful for seniors is having social isolation. So if they no longer live with anybody, if their spouse has passed away or has had to move into a nursing home, and now they're living by themselves at home, those lack of social interaction really impacts seniors a lot, because the mind is like any other muscle. Use it or lose it. And so if you're not challenged by having to keep a short-term memory during conversation, or answer somebody when they ask you a question that's coming from the side that's not what you're focused on, but you still have to answer. If you don't have those simple challenges that we don't think about every day, but they actually are challenging our brain, then we really start declining with a lot of our ADLs, which is activities of daily living. So having that social isolation is a huge factor for seniors.
Many seniors are living with and caring for an elderly loved one, which can be their spouse, life partner, or perhaps a parent. Being a caregiver has a tremendous impact on a senior's overall health.
Being a caregiver can be a positive impact on a senior's health or a negative impact. So often in the situation we're talking about a spouse or loved one who is sick because they're also elderly senior, and then they're taking care of their spouse or loved one. So on the one hand, it can be a healthy impact because maybe they're both having to follow their diet and take their medicines and be very compliant with the treatment plan, and that might help both of their health. It may also help their health to give them something, a purpose in life to work for. That alone is really impactful. It keeps people going and motivates you. So that can be good. On the other side, being a caregiver, especially if the person that you're taking care of is very, very, very ill, that can be incredibly stressful, emotionally, mentally, and physically. You might be lifting your loved one every time they need to go to the bathroom, and you might yourself have weak bones or osteoporosis, and so that's very potentially dangerous. You could just get a fracture anytime. So it depends what level of caregiving they're doing, really. It might be good, it might be too much. So you always have to make sure, if you're taking care of, if your patient is the caregiver of somebody else, you have to ask them and make sure, how are you doing with this? How do you feel? Do you take any time for yourself? Do you even take 30 minutes a day for yourself? Have you given up everything that you love just to do this other job now? And ask them how it's impacting their life. And when you find out those answers, then you can offer them simple things like, hey, maybe just, especially this works if your patient is a female, hey, why don't you just take a bath and turn on nice music and put some smelly stuff in the water a few times a week for yourself. And a lot of times that's enough. Or if the patient is a male, you say, hey, still go play golf 1 round a week with your friends. This person will be okay. Your loved one will be okay for 3 hours. That's fine, If it's something really more than that, the other advice that you can offer to your patient is to help them get linked in with resources for patient care attendants to come to the house. That can be expensive, but there are some things that qualify for that, and they might be able to get financial assistance. So at least offer it and see where that goes. Or offer adult daycare. So if they need to do something, let's say they need to go to their own doctor's appointment, then maybe they should take their loved one to the adult daycare for the day so that they have enough time to have their doctor's appointment, get their labs drawn, maybe even, stay around for other things or do something else, dentist and doctor or something at the same time. So that would also be a good strategy. When you're trying to figure out if stress or nutrition is impacting a person's health, of course, the hard facts you can use. So what's their BMI? Has it changed? Have they lost a lot of weight or gained a lot of weight? Those are your hard facts that you should look at in your vitals section every time you're assessing a patient. But sometimes that doesn't really change that much. So there's not a lot of facts that prove that somebody is having a poor diet or that they're very stressed out. And so then you're really going to get to that in your social history questions. And you ask, how are you doing? Most offices around the country nowadays use a screening tool for depression, a 2-question screening tool. So that's usually done either by the nursing staff when they're taking the vitals or by the provider during the social history. So they would also ask, it could come up that way, especially the stress part. So the primary care provider or the geriatrician for an elderly patient is really the person who should know that patient so well that they can pick up on subtle changes in stress levels. And often it's true that when a patient has been a caregiver for the loved one, if their loved one dies, they call their primary care doctor as one of the first calls and they say, hey, my husband passed away, I just wanted to update you. But they feel enough of a connection with their primary care doctor that they know that this person is going to know what that means to their health, means to them emotionally and physically. And they count it as a equally important update, just as if, hey, I just got out of the hospital with surgery, my gallbladder's gone. It's just as important for them to give that update. So making that connection where you are the first stop for them, for anything that happens in their life, any change that they feel, that's when you can really make an impact.
When your patients feel like you know them, they will be more comfortable talking to you about the changes in their circumstances and how these things are impacting their health.
My arthritis was giving me a lot of trouble, so much so it was too painful for me to drive anymore. One day I almost fell in the grocery store. I wasn't hurt, just embarrassed, but it really scared me. I started using a cane, but to be perfectly honest, I was very afraid about falling and getting hurt. I started going out less and less, and I was embarrassed about my home because I couldn't clean it the way I used to. Another reason I was in so much pain was because I wasn't taking my arthritis medicine the way I was supposed to. You see, I'm on a fixed income, and the medicine was so expensive that I cut the pills in half to make it last longer. But it really wasn't helping with the pain anymore. I finally broke down and told my doctor what was going on.
Falls are one of the most common reasons for hospital visits by older adults.
One of the most important things that the primary care doctor can do is to help keep the patients out of the hospital. Because any day that you're in the hospital, you have a decline in your independence significantly. They've done big studies on this that show that if elderly patients stay in the hospital a few days extra or any kind of complication, when they leave the hospital, they usually have lost one function of their activities of daily living. So if they used to be able to cook for themselves, do their own laundry, do their own finances, and climb the stairs by themselves, if they're in the hospital one time, one of those goes away. They can't climb the stairs. Then something happens, a complication, they go back to the hospital, another one goes away. And then you see really quickly that you can get to zero. And the patient who was living independently, now they have to go to an assisted living facility, really just because they were in the hospital for a few days. So being proactive, keeping them out of the hospital is how they can maintain their independence. So community services and services that can come to the home of elderly patients are hugely important to help keep seniors healthy. So for example, some of the most popular ones you hear about, Meals on Wheels. You hear about that all the time. That is hugely important because they have specified diets for certain things like diabetes or heart failure. They can keep your patient healthy, and they can prevent your patient from having falls in the grocery store, they break a hip, or having a total undernutrition because they're not able to cook for themselves at all, or they're not able to drive anymore because of their vision declining, or they have a bad hip, they can't hit the brakes. So they can still get good, healthy meals for them. When you refer a patient to a health and wellness class, they're going to get a lot of self-management support and tips for how to live their life and make small changes that are really going to keep them quite healthy. So that's a perfect example of stuff that's really helpful. Another really great example is getting referrals for like audiology and hearing aids through the community and helping to get those patients hearing again. If they don't, then of course the rest of their life is going to be impacted by that. They're not going to be able to interact with their loved ones. Their family might call them on the phone. They can't really hear the phone. So unless they meet in person, they're not going to have any interaction. So those are some simple but really important examples of how accessing the community and keeping people engaged with whatever resources are available for social, medical, or kind of like personal care are very more important for seniors than for other patients.
There are many community-based as well as home-based services available to seniors and their caregivers, but local resources will vary from one community to the next. The good news is your local Aging and Disability Resource Center can provide up-to-date information and referral services to your patients by simply calling the Elder Helpline at 1-800-96-ELDER. It's also important for patients to understand Medicare and what services are covered by their health insurance plans. The SHINE program provides free and unbiased Medicare counseling and can be accessed by calling the Elder Helpline. SHINE can also provide your patients with information about special Medicare programs they may qualify for to help them with their out-of-pocket medical costs.
Thanks to my doctor's advice and the referrals I got from the Elder Helpline, I am taking the right steps to get my diabetes back in check and feeling like my old self again. I'm saving money on my prescriptions, and I even met some new friends at my diabetes class. If I ever run into trouble like that again, I know who to call.
When you get to know a patient over a long period of time and you see how they manage with their life, and you see maybe you get them through that hip replacement and now they're able to go and play golf again or tennis again, that is so rewarding in how they gain some more time in their life that they didn't think they would ever be able to get back to doing again. That's really very, very rewarding. I mean, that's why we do it.